Hello, I'm Alma Angeles, and you're watching Eagle News International.
And I'm CJ Hero. Welcome to the program. On tonight's headlines.
President Donald Trump began his final full day in the White House with a long list of possible pardons to dish out before snubbing his successor Joe Biden's inauguration and leaving for Florida.
Norway said no link had been established between Pfizer-BioNTech's COVID-19 vaccine and post-vaccination deaths in the country, but recommended doctors consider the overall health of the most frail before giving them the jab.
A new strain of the coronavirus, different from the highly contagious UK variant, has appeared in California.
And an Italian Centenarian has become one of the oldest people in the world to get a COVID-19 vaccine months after she survived a coronavirus infection.
First, President Trump began his final full day in the White House with a long list of possible pardons to dish out before snubbing his successor Joe Biden's inauguration and leaving for Florida. According to CNN and other U.S. outlets, President Trump has a list of about 100 people he will grant clemency to. After what the New York Times reports has been an intense lobbying effort, these are expected to be a mix of white-collar criminals and people whose cases have been championed by criminal justice activists. More controversial possible pardons that have been the subject of speculation for months would be for the likes of Edward Snowden, Julian Assange, and Trump's influential advisor, Stephen Bannon. On Wednesday at noon, Biden will be sworn in.
Meanwhile, First Lady Melania Trump released a farewell message Monday as she prepares to leave the White House, saying that violence is never the answer, weeks after the president's supporters stormed the U.S. Capitol. Watch this.
My fellow Americans, it has been the greatest honor of my life to serve as First Lady of the United States. As the world continues to confront the COVID-19 pandemic, I thank all of the nurses, doctors, healthcare professionals, manufacturing workers, truck drivers, and so many others who are working to save lives. We grieve for the families who have lost a loved one due to the pandemic. Every life is precious, and I ask all Americans to use caution and common sense to protect the vulnerable, as millions of vaccines are now being delivered. When I came to the White House, I reflected on the responsibility I have always felt as a mother to encourage, give strength, and teach values of kindness. It is our duty as adults and parents to ensure that children have the best opportunities to lead fulfilling and healthy lives. The passion for helping children succeed has driven my policy initiatives as First Lady. I launched Be Best to ensure that we as Americans are doing all we can to take care of the next generation. As I say farewell to my role as First Lady, it is my sincere hope that every American will do their part to teach our children what it means to be best. In all circumstances, I ask every American to be an ambassador of Be Best, to focus on what unites us, to raise above what divides us, to always choose love over hatred, peace over violence, and others before yourself.
The outgoing president and his wife have also not invited Biden and his wife Jill for the traditional tea visit in the Oval Office and will not attend Biden's presidential inauguration on Wednesday.
Meanwhile, thousands of U.S. flags are placed on the grounds of the National Mall in Washington, D.C., where visitors arriving from around the country would normally stand and watch the presidential election. Since Trump supporters stormed the Capitol on January 6, security officials are preparing for anything that could threaten Biden and his supporters in the run-up to the inauguration. Most traffic has been barred from Washington's vast downtown. For 2 days, main bridges into the city will also be closed. The Capitol, the White House, and other main buildings are all barricaded and will be defended by more than 20,000 armed National Guard members. Previous well-attended inaugurations saw more than 1 million people descend on Washington. But this year, there will be no place to go. The National Park Service will close the National Mall and the sprawling green space between the Capitol and the Lincoln Memorial. Instead, the vast ground will be planted with 200,000 flags.
U.S. President-elect Joe Biden's spokeswoman quickly dismissed Donald Trump's announcement Monday that a COVID-19 ban on travelers arriving from much of Europe and Brazil would be lifted, underlining the fractious transition of power. On the advice of our medical team, she said the administration does not intend to lift these restrictions on January 26, tweeted Jen Psaki, Biden's press secretary. In fact, she said, we plan to strengthen public health measures around international travel in order to further mitigate the spread of COVID-19. Just minutes before she tweeted this, President Trump said he would lift the travel ban on Europe and Brazil, although travel bans for China and Iran would remain in place. This action is the best way to continue protecting Americans from COVID-19 while enabling travel to resume safely, he said in a statement released by the White House. Both Biden and Trump's statements come days after the Centers for Disease Control and Prevention announced that all air passengers bound for the U.S. will be required to test negative for COVID-19 within 3 days of their departure. The test policy will take effect on January 26 and expands on a previous testing rule that targeted Britain and came into effect in December following the emergence of a coronavirus variant believed to be more transmissible. Some epidemiologists have warned it is likely that new, more transmissible variants are already establishing themselves in the United States, the hardest hit country in the world by the pandemic.
Meanwhile, New York Governor Andrew Cuomo called on pharmaceutical company Pfizer to sell doses of its coronavirus vaccine directly to New York State. The request would require Pfizer to circumvent the federal government's Operation Warp Speed, a campaign to produce and distribute some 300 million doses to Americans in an effort to end the pandemic, and deal directly with Cuomo's state administration. Let's listen in.
When the hospital capacity is endangered, that's when we have to go to full shutdown. Well, the numbers are coming down. Yes, the numbers are coming down. If the UK strain hits, if the Brazilian strain hits, if the South African strain hits, you can see those numbers turn around, right? So deal with today, anticipate tomorrow. Yes, the numbers are coming down today. If we have a second wave by a new strain, you'll see that number go back up. Unvaccinated doctors and nurses are still a problem. You put unvaccinated nurses and doctors together with a second wave, that should keep us all up at night. When we talk about hospital capacity, it's not that hospitals are running out of beds or equipment. Hospitals are running out of staff. That's what's happening. And if the staff gets sick, then the number of eligible staff comes down. They must increase the supply. Approve Johnson & Johnson, expedite that. Buy more Pfizer, buy more Moderna, buy more Oxford AstraZeneca. Do whatever you have to do to increase the supply. As a state, we're trying to do everything that we can. I sent a letter to the Pfizer Corporation today. Pfizer is technically not bound by any federal agreement because they did not get engaged in what the federal government called Operation Warp Speed, where they gave money to drug companies to expedite the vaccine. Pfizer is a private company. They produced it on their own. They can do what they want with it. I sent the president and chairman, Mr. Borla, Dr. Borla, a letter asking if New York could buy directly from Pfizer so we could increase our supply. Pfizer is a New York company. They're headquartered here, and I sent a letter asking for if New York could buy directly from Pfizer.
We appreciate Governor Cuomo's kind words and the pride he expressed in his letter that Pfizer is a New York headquartered company. The firm told Insider in an email on Monday, Pfizer is open to collaborating with HHS on a distribution model that gives as many Americans as possible access to our vaccine as quickly as possible, the company added, but noted that it would need the green light from the HHS before such a sale could take place. As of Monday evening, more than 645,000 vaccines had been distributed in the state of New York, according to the Coronavirus Resource Center at Johns Hopkins University. Now, that number of doses would be enough to reach 3.3% of New York's statewide population, which was determined to be nearly 19.5 million people, according to 2019 U.S. Census Bureau data.
Meanwhile, a new strain of the coronavirus, different from the highly contagious UK variant, has appeared in California, where the total number of cases approaches 3 million, according to a report. The state's Department of Public Health said it's unclear whether the variant, which has popped up in a dozen counties, is highly contagious or is just being identified more frequently as lab work becomes increasingly sophisticated, the LA Times reported. Dr. Sarah Cody, Santa Clara County Health Officer and Director of the Public Health Department, said in a statement, quote, "This virus continues to mutate and adapt, and we cannot let down our guard." The new variant also has been reported in Los Angeles, Orange, Riverside, San Francisco, San Bernardino, San Diego, Humboldt, Lake, Mono, Monterey, and San Luis Obispo counties. Some epidemiologists have warned it is likely that new, more transmissible variants are already establishing themselves in the U.S., the hardest hit country in the world by the pandemic. The new California variant has 3 mutations on the spike protein, Dr. Charles Chu, a virologist at UC San Francisco, told the New York Times. It was first detected in Denmark in March and in California in May.
A panel of independent experts has concluded that China and the World Health Organization could have acted faster to avert catastrophe during the early stages of the coronavirus outbreak. The independent panel for pandemic preparedness and response said its evaluation of the start of the crisis in China suggests that there was potential for early signs to have been acted on more rapidly. Containment measures should have been implemented immediately in all countries where transmission was likely, the panel said in their second report, due to be presented to the WHO's executive board on Tuesday. COVID-19 was first detected in the central city of Wuhan in late 2019 before seeping beyond China's borders to wreak global havoc, costing more than 2 million lives and eviscerating economies. The WHO has already faced claims it was also too slow to declare an international crisis, to acknowledge the virus was spreading through the air, and to recommend face masks. Outgoing U.S. President Trump accused the organization of botching its handling of the pandemic and of being a puppet of China. The panel, led by former New Zealand Prime Minister Helen Clark and former Liberian President Ellen Johnson Sirleaf, began its work in July after WHO member states called for an impartial, independent, and comprehensive evaluation of its response to the pandemic. The panel said it was clear that public health measures could have been applied more forcefully by local and national health authorities in China in January. The report also criticized the WHO for dragging its feet at the start of the crisis, pointing out that the UN Health Agency did not convene its emergency committee until January 22 last year.
In a related news, China defends its handling of early COVID-19 cases, but says it would strive to do better after independent experts said Beijing and the World Health Organization could have acted faster to avert the pandemic. Watch this.
我们当然应该努力做得更好。我想，任何一个国家，不仅是中国、美国、英国、日本，或者任何一个国家，都应该努力去做得更好。因为我觉得应该追求在 事关公共卫生这样的问题上，永远都是没有最好，只有更好。那么中国呢，作为最早拉响全球抗疫警报的国家，即使在当时信息还不全面的情况下，当机立断，果断决策。
According to the panel report, the WHO and the national authorities were also not quick enough to warn that the virus could spread between people, including those without symptoms could pass it on. It also questioned whether the WHO should have used the word pandemic earlier than it did. The WHO did not use the word until March 11 last year, repeatedly insisting before that date that it did not need to use it. And the word pandemic does not feature in the official WHO alert system. But the panel hinted countries may have taken the situation more seriously if the word had been used, stressing it serves to focus attention on the gravity of the health event. COVID-19 was first detected in the central city of Wuhan in late 2019 before seeping beyond China's borders to wreak havoc in the global scale, costing more than 2 million lives and eviscerating economies.
Meanwhile, a new variant of the coronavirus first identified in South Africa is more contagious than early versions, experts said, but there is no evidence that it is more deadly. The new variant is 50% more contagious, according to epidemiologist Professor Salim Abdul Karim, co-chair of the Health Ministry Scientific Committee. But he said there's no evidence that the new COVID variant is more severe than the original variant. The experts drew their conclusions about the variant, now the dominant strain in South Africa, from an analysis of data collected from the main infection clusters around the country. With more than 1.3 million people infected, South Africa has recorded more cases than any other country on the continent and has also suffered more deaths, with 37,105 registered. The second wave of the virus has stretched South Africa's health system to its limits.
In other news, Norway said Monday no link had been established between Pfizer-BioNTech's COVID-19 vaccine and post-vaccination deaths in the country, but recommended doctors consider the overall health of the most frail before giving them the jab. Let's listen in.
Legemiddelverk, og det folk som har høy alder, skrøpelige og har alvorlige sykdommer, samtlige av dem. Og alle vil bli undersøkt. Når det gjelder årsakssammenhengen, så det ikke gjort noen analyser av den. Det viktig å huske at det dør ca. 45 personer hver dag i sykehjem i Norge, slik at det ikke gitt at dette representerer noen overdødelighet eller at det noen årsakssammenheng. Men det kan tenkes at en del av de som har fått vaksinene såpass skrøpelige at man kanskje burde tenkt seg om og ikke tilbudt dem vaksine, fordi de såpass syke at de muligens blir dårligere av å få de normale bivirkningene som man får når kroppen reagerer med å bygge opp immunitet. Så Folkehelseinstituttet har presisert det rådet som har gjeldt hele tiden, eller som har vært gjeldende hele tiden, om at man skal ha en vurdering av hver enkelt før man tilbyr vaksine.
Since the start of Norway's vaccination campaign at the end of December, the country has registered 33 deaths among elderly people who have received their first dose, according to public health authorities. Of the 13 cases analyzed in detail so far, They are people of advanced age, are frail, and have serious illnesses, all of them. The director of the Norwegian Institute of Public Health, Camilla Stoltenberg, told reporters. After the reports of deaths, Norway has nonetheless stressed that doctors should individually consider whether patients who are frail or terminally ill should receive the vaccine, as is also recommended in some other countries.
National Policy Against COVID-19 Chief Implementer and Vaccine Czar, Secretary Carlito Galvez Jr., stood firm that there is no corruption in the government's efforts to procure coronavirus vaccines. While the government recognizes the right of the people to know the details of vaccine deals, Galvez said they cannot easily disclose premature terms of transactions since all contracts are still under negotiations. Let's listen in.
Si Secretary Dominguez din po ang tumitingin dahil kasi being yung pera po niyan ay dineliberate po ng NEDA at talaga pong yung mga tao na nandiyan po talaga is talagang maasahan po natin. Kasi ang po natin din yung tinatawag nating yung sa Asian Development Bank, nandiyan po si Executive Director Paul Dominguez at saka po yung World Bank. Napaka-stringent po ng ng tinatawag na transparency at saka yung anti-corruption clause. Alam naman po natin ng ADB, more than 26 countries ang namumuno po dyan. At talaga pong hindi tayo makakalusot. Kung kunyari meron tayong PECP na magkaroon ng tinatawag na mga deals, malalaman po nila dahil kasi yung deal po ng vaccine, lahat po ng deals ng mga vaccine na loans sa different countries, malalaman po nila kung disadvantage po tayo. So ganun po ang ng ADB. Parang siya po ang third party na fund manager natin na pinangangalagaan din po yung kanilang pera at yung pera natin na ilo-loan po sa kanila. Hindi po tayo roon na tinatawag nating corruption because of the World Bank integrity at saka po yung Asian Development Bank.
May I just ang ibig sabihin ni John Galvez is walang hinahawakan ng pera ang Republic of the Philippines, ang gobyerno o sino man. Ang ibayad natin ay yung hiniram natin sa bangko. Ang magpabili sa atin ng manufacturer, kunin nila ang bayad hindi sa kamay ni Galvez, hindi sa kamay ni Dominguez, hindi sa kamay ko. Papel lang yan, dalhin nila doon sa World Bank. Tapos, i-remit na nila papel lang rin doon sa kanilang account. Sa manufacturer. Yan walang yan. Walang house yan.
Galvez said revealing the vaccine's price list during negotiations could affect the credibility and reputation of the government to negotiate. It could also compromise the country secured 148 million doses of vaccines from various pharmaceutical companies, he added. However, he assured that all the details of the transaction for vaccine acquisition will be divulged once negotiations are finalized.
Meanwhile, Taiwan called off its largest Lunar Year Lantern Festival for the first time on Tuesday as authorities rushed to stem a COVID-19 cluster in one of the few places to survive the pandemic largely unscathed. The 3-decade-old event, which typically sees up to 1 million visitors, was cancelled after 4 coronavirus cases were linked to an outbreak at a state-run hospital. Over the last fortnight, 5 other doctors and nurses, as well as 2 of their family members and a Vietnamese caregiver, have contracted the virus both in and outside the hospital, bringing the cluster's total infections to 9. One of the new patients was a woman, the daughter of a nurse, working at a Moza Burger outlet in Taoyuan Metro Station, according to the Central Epidemic Command Center. Taoyuan General Hospital will partially evacuate 220 patients to lower risk of infection and ease the burden on its staff. Taiwan has been praised for its pandemic response, with fewer than 870 cases and 7 deaths so far. So far, 353 employees at the hospital have started a 2-week quarantine, and health authorities are tracing and testing all contacts of the new cases, according to the CECC.
In Hong Kong, Chief Executive Carrie Lam said the current social distancing measures will be extended due to the latest COVID-19 pandemic situation. Let's listen in.
In light of the latest COVID-19 pandemic situation, it is quite obvious that there is no room yet for us to relax the social distancing measures that have been put in place. So I have already implied that they will be extended. But I will leave the Secretary for Food and Health to announce the exact measures and the duration of this round of extension of the social distancing measures. But at the same time, I fully understand the hardship on the various business sectors, especially those that have been required to close for more than or over 2 months now. So I have said that last Tuesday I said it here, and I repeated it just now, that I have asked my bureaus and departments to sit down and discuss with the various sectors on whether we could find more sophisticated means to enhance the infection control and to enhance contact tracing of the staff and of the customers, so that there could be a possibility for some resumption of business in due course.
The Hong Kong government announced that aside from staff providing emergency and essential public services, as well as those involved in anti-epidemic efforts, all government employees will continue to work from home until January 27. It said in view of the local COVID-19 epidemic situation, it's necessary to continue to take measures to reduce people flow and social contact to stop the virus from spreading in the community. The government will review the arrangement before January 27, and its ultimate goal is to resume full public services when conditions permit.
In other news, Britain's Oxford University has received a donation of £100 million to research on growing resistance to antibiotics. We have Aribel Celestino of our ABC UK Bureau with that story. Aribel.
Hi, CJ, and yes, Britain's Oxford University has received a donation of £100 million, which equals to 112 million euros and $136 million, to research growing resistance to antibiotics, the university announced on Tuesday. The sum from British chemical multinational Ineos is one of the largest donations given to Oxford University in its long history. Well, CJ, the funding will be used to launch a new institute to combat the growing phenomenon of antimicrobial resistance, AMR, caused by the increasing exposure of animals and humans to the medicines which treat diseases caused by bacteria. Increasing antibiotic resistance already causes 1.5 million excess deaths each year, the University of Oxford has said. By 2050, up to 10 million deaths each year could be caused because antibiotics and other antimicrobial drugs are no longer effective against common diseases. Oxford Vice-Chancellor Professor Louise Richardson said the coronavirus pandemic had shown the urgent need to deal with the cataclysmic threat posed to the public health by antibiotic resistance. She also mentioned they were aware of the high potential for another pandemic, as they were constantly reminded. However, they were still caught unprepared. Each year, human antibiotics are becoming fewer because of the growth of resistance, so it is essential that they act. The impact of being unprepared for the pandemic underlines the importance of acting before it's too late. INEA's chief executive Jim Ratcliffe said collaboration between industry and academia was now crucial to fight against AMR. He also added how excited they are to partner with one of the world's leading research universities to advance progress in tackling this top priority global challenge. You know, CJ, the discovery of penicillin, the world's first antibiotic, was made at Oxford and has subsequently saved millions of lives around the world. In partnership with the British drugs company AstraZeneca, a team at Oxford University also developed one of the first vaccines to protect from COVID-19. David Sweetnam, an advisor to the INEA's Oxford Institute, said that vaccines created in record time to offer light at the end of the tunnel were developed with research conducted long before COVID-19 struck. And it is also clear that they should be looking right now for new antibiotics with the same urgency as we have been for vaccines. Over to you, CJ.
Thank you so much, Aribel. So just to clarify, it's Oxford University will be creating a new institute that will be studying the resistance to antibiotics, right?
Yes.
Okay, well,
yes.
Sign of the times. Well, this is a very important development, and I hope all countries will follow suit. As you mentioned earlier, this is not going to be the last pandemic that the world will be facing in the next few years. Thank you so much, Aribel. Please do stay safe out there.
Thank you so much, CJ, for having me reporting from the United Kingdom. I'm Aribel Celestino. We live in interesting times.
Thank you.
Thanks, Aribel. And the news continues here on Eagle News. We'll be right back.
This portion is brought to you by Canriv Corporation, your ventilation and air conditioning specialist. Services offered: supply and installation of elevators, escalators, air conditioners, ventilators, jet towel, hand dryers, generators, access control system, factory automation, and modernization. For more info, please contact Ami Kanke at 0915-263-7198 or 0998-900-3224.
Welcome back. Business and government leaders currently see the loss of life from COVID-19 and related economic effects as the world's greatest short-term threats, according to the World Economic Forum today. Let's listen in.
2021 will be crucial. It will be a pivotal year for the future of humankind. It will be crucial because we have to continue to fight the virus, but we have to move out of the pandemic, and we have to create sound economic growth, which is more resilient, more inclusive, and more sustainable. But what we have to do above all is to restore trust in our world. Trust is needed in order to overcome the crisis, but trust is needed as a base to have a future-oriented mind and to construct the world for tomorrow.
We know that we are all in the same boat, and we have to collaborate to really make progress. Look at COVID. COVID anywhere is COVID everywhere. And to open the first day in the afternoon, we have the UN Secretary General Antonio Guterres addressing the Davos Agenda Week, looking at how we can strengthen multilateralism in a world that is, of course, polarized and where we have geopolitical challenges.
The risk of social cohesion erosion due to the pandemic and joblessness was deemed another critical short-term threat. The report noted that young adults are experiencing their second major global crisis in a decade, having lived through the disruption of the financial crisis and the economic inequality it aggravated. The World Economic Forum itself has been disrupted by the COVID-19 pandemic, shifting its usual January summit in Davos to May in Singapore. Nevertheless, next week, the WEF will be holding a virtual Davos, a week of events dedicated to helping leaders choose innovative and bold solutions to stem the pandemic and drive a robust recovery over the next year.
In other news, the European Union Aviation Safety Agency plans to clear the Boeing 737 MAX to fly again next week, 22 months after the plane was grounded following 2 fatal crashes. The MAX was grounded in March 2019 after 2 crashes that together killed 346 people, the 2018 Lion Air disaster in Indonesia, and an Ethiopian Airlines crash the following year. Investigators said a main cause of both crashes was a faulty flight handling system known as the Maneuvering Characteristics Augmentation System, or MCAS. Meant to keep the plane from stalling as it ascends, the automated system instead forced the nose of the plane downward. The findings plunged Boeing into crisis, with more than 650 orders for the 737 MAX canceled since last year. EASA Director Patrick Kai said it had already been indicated in October that EU approval was likely after Boeing promised a new sensor would be added to prevent the type of problem that caused the crashes.
Meanwhile, England and Scotland went back into a weeks-long lockdown this month, similar to the first national coronavirus curbs in place from March to June, as the UK government looked to halt a variant COVID-19 strain that is said to be more contagious. Economists are warning that current restrictions could spark a double-dip recession. Here's Patricia Rodriguez.
England and Scotland went back into a weeks-long lockdown this month, similar to the first national coronavirus curbs in place from March to June, as the UK government looked to halt a variant COVID-19 strain that is said to be more contagious. Economists warn that current restrictions could spark a double-dip recession after the economy had slumped into a historic downturn last year following the initial lockdown. According to EY economist Howard Archer, with lockdowns across UK back in place and set to remain until mid-Feb, the economy will definitely be challenged this 2021 and is expected to contract this first quarter, resulting in a double-dip recession. Meanwhile, British Finance Minister Rishi Sunak repeated his remarks from last week, by which he declared that the economy could get worse before it gets better. Nonetheless, Sunak had expressed optimism by saying that there are reasons to be hopeful, namely with the rollout of vaccines underway and with the government's stimulus plan of creating new opportunities for those most in need. This includes initiatives such as the Furlough Job Support Scheme, which should cover the bulk of private sector wages until April. It should be noted that Britain has been the European nation worst hit by the devastating pandemic, with a death toll of more than 86,000. Amidst this, the government is pinning its hopes on a mass vaccination drive, which has so far seen around 3 million people vaccinated. Reporting from London, United Kingdom, I'm Patricia Rodriguez. We live in interesting times.
Thank you, Patricia. Now, in other news, food parcels are distributed by charity groups in Tokyo to help the growing number of Japanese pushed into poverty by the coronavirus pandemic. Economists say that 500,000 Japanese lost their jobs in the past 6 months, and campaigners say the ripple effects are spreading across the population. Watch this.
表面的には助けてるようにはなってるかもしれないですけど、本当に困ってる人たちは駅とかいろいろ段ボールで寝てたり多いです。日本は結構マスコミとかには報道されてないけど、だいぶ餓死とかしたり大変なことになってます。ご飯食べれない人多いし、昔は不老者の仲間とかもいましたけど、結構今は若い人もいるし、結構大変です。
働いているけれども非正規で所得が低い人がいる。またいわゆる社会的な仕組みとしても正社員だったり家族の援助というのはある程度見込んだ制度になっているので、そこからこぼれた時に、非正規だったりとか家族との関係があまり良くない時に、貧困になりやすいっていうところがあると思うんで、そういった意味での見えにくさみたいなのはかなり特徴があるかなっていうのは思います。
The United States has urged Australia to abandon its plan to force Google and Facebook to pay media outlets for their news content, saying there could be long-lasting negative consequences for consumers and companies. Australia wants to force the U.S. tech giants to pay local media organizations for hosting news content or face millions of dollars in fines, in one of the most aggressive moves globally to check their power. It will apply to Facebook's news feed and Google searches, prompting the digital firms to threaten to limit the services they offer Australians. In a submission to an Australian Senate inquiry in the draft legislation, the Office of the U.S. Trade Representative called it a burdensome plan that will exclusively target two American companies without having first established a violation of existing Australian law or a market failure. Canberra's initiative has been closely watched around the globe as news media worldwide suffer in an increasingly digital economy where advertising revenue is overwhelmingly captured by big tech firms. The Australian Senate inquiry is due to begin public hearings on Friday.
In other news, Parler, the social network popular among conservatives, could return to Apple's App Store if it changes how it moderates posts on the platform, the tech giant's CEO Tim Cook said Sunday. Apple suspended all downloads of the Parler app following the attack on the U.S. Capitol on January 6, citing postings on the platform that could incite further violence. Google and Amazon also cut ties with the company. Parler sued Amazon on Monday after Amazon Web Services cut off the platform's access to internet servers. Parler alleged Amazon was violating antitrust laws and acting to help social rival Twitter, which also has banned Trump for language that could incite violence. Parler's popularity skyrocketed after Twitter permanently banned Trump following the Capitol attack, which Cook called one of the saddest moments of my life and an attack on our democracy. The day Apple suspended downloads for Parler, it was the top downloaded app from the App Store in the U.S. Google has also banned downloads of the app. Parler, which launched in 2018, operates much like Twitter, with profiles to follow and parleys instead of tweets. In its early days, the platform attracted a crowd of ultra-conservative and even extreme right users. But more recently, it has signed up many more traditional Republican voices.
Richard Branson's Virgin Orbit project successfully flew a rocket into space from the wing of a 747 plane, paving the way for a new method of launching low-cost satellites. Take a look. It was the company's second attempt at the feat after a failed test in May. The plane took off from Mojave Air and Spaceport in the desert north of Los Angeles and launched the rocket over the Pacific Ocean. Founded by British billionaire Richard Branson in 2012, Virgin Orbit wants to offer a quick and flexible service for operators of small satellites weighing between 300 and 500 kilos, a market which is booming. The 70-foot Virgin Orbit rocket, named Launcher 1, is strapped to the underside of a wing on a converted Boeing 747 named Cosmic Girl.
We have more stories for you. Don't go away.
This portion is brought to you by Hubert, an expert in air conditioning and electromechanical, also engaged in structural, electrical, fire protection, plumbing, and sanitary services. Hubert, your ultimate MEPS air conditioning solutions.
Mula noon hanggang ngayon, gabay natin ang MTRCB ratings sa matalino at responsableng panonood. Sa tamang pagsunod sa MTRCB ratings, ginagawa nating ligtas at makabuluhan ang panonood ng bawat miyembro ng pamilyang Pilipino. Lumipas man ang panahon, hanggang may pamilyang Pilipino, andyan ang MTRCB.
Welcome back to the news. An Italian centenarian has become one of the oldest people in the world to get a COVID-19 vaccine months after she survived a coronavirus infection, her retirement home said. Fatima Negrini, who is due to turn 109 on June 3, received the jab on Monday, along with other residents of the Anni Azzurri San Faustino Care Home in Milan, a spokesman told AFP. The arrival of the vaccine for her and all guests and staff represents a moment of great happiness and a first step towards a return to peaceful everyday life inside the facility, said Matteo Tessarolio. Italy began coronavirus vaccinations on December 27 and has since inoculated 1.15 million people.
Meanwhile, Sarah Dwyer, a chocolatier near Washington, D.C., celebrated the upcoming presidential inauguration of Joe Biden and Kamala Harris with a special collection of chocolates. Take a look.
So we make the Kamala Harris chocolates with all vanilla sea salt caramel. So it's a sweet caramel. We sprinkle the salt in by hand, and then it mixes with either the milk or the dark chocolate. So you get a little bit of sweet, a little bit of salty, and then you get the bitterness from the chocolate. So it's a little bit of... So with Joe Biden, we added a car, and it says Riding with Biden. It has a picture of him in his aviators and Cup of Joe, just the things that people like about him. And with Kamala Harris, trendy. So I love wearing Chuck Taylors, and I think that she wears them to be casual and comfortable is really cool too. So we made sure we put those on there. But they're standing on a container of glass because she basically broke the glass ceiling wearing a pair of Chuck Taylors, which I think is super cool. And then being able to create something for our own very first female vice president really made me proud as a female entrepreneur. So I think a gift of the Kamala Harris chocolates or the Joe Biden chocolates is a little bit of reconciliation. Because if you give it to someone who might not be on the same political side as you, I think you can share just something a little bit sweet together. And I think that's nice.
Sarah Dwyer said the chocolates has sold almost 10,000 Kamala Harris-themed chocolates, making them more successful than the Joe Biden-themed chocolates. The company started making politics-themed chocolates for the second presidential inauguration of Barack Obama. The company then made Hillary Clinton and Donald Trump chocolates in 2016. The Chocolates also makes chocolates inspired by Anthony Fauci, the director of the U.S. National Institute of Allergy and Infectious Diseases, who has become a celebrity for his role in fighting the COVID-19 pandemic in the United States. I love dark chocolate.
Me too. I was just going to say I want to buy chocolates later with almonds. Well, that's it for tonight's broadcast. Thank you so much for joining us. I am CJ Hero. Please join us again tomorrow.
And at the end of the day, as I always say, there remains so much more to be grateful for. I'm Alma Angeles, and we live in interesting times.